Good day, dear friends. Today we will be discussing about the identification of a sick newborn. The most important information that we are supposed to gather is the date of birth, time of birth, birth weight, which is a very important marker, and the mode of delivery, which is either a normal vaginal delivery or a cesarean section. The information that we are supposed to know is the antenatal period, which includes any issues like gestational diabetes, maternal hypertension, pregnancy-induced hypertension, which is otherwise called as, and also certain other infectious diseases like urinary tract infection, hypothyroidism, etc. All these factors are very important for us to come to a conclusion whether the newborn is sick or not. During the postnatal period or the intranatal period, that is during the time of delivery or after the delivery, certain important issues are also important for us, like whether the child cried immediately or not. Now, how to identify a sick newborn? Basically, the newborn children are very difficult to diagnose because they have very subtle signs. These signs do not show towards any direction, or rather they are not pointers or indicators of any disease. The symptoms that are usually seen are highly non-specific in nature. Lethargy, poor feeding, cold extremities, and any other underlying systemic problems like a congenital heart disease are very important for us to consider. And also, these will help us to identify a sick newborn. How to evaluate? There are certain finer principles where evaluation of a newborn child begins. For parental information, we also tell about these things which are an important indicators for them to seek medical attention. For example, presence of convulsions or fits or seizures. This might indicate a serious neurological problem or infections or infection that spreads to the brain, which is otherwise called as meningitis. A dull, lethargic, comatose, not feeding newborn is considered as a very sick child. Coming to the evaluation of respiratory system, fast breathing, or we call it as tachycardia, which is more than 60 breaths per minute, is a worrisome sign, and in this scenario, seeking urgent medical attention is of great help. Certain other symptoms like respiratory distress, which involves subcostal and intercostal retractions, also are very important for us to identify a sick newborn. Presence of bluish palms and soles, which is called as cyanosis, can indicate a cardiac condition. The cardiac abnormalities can be classified as cyanotic congenital heart disease and acyanotic congenital heart disease. It depends upon the severity and also the function of the cardiac system. Temperature measurement and temperature regulation are the integral part of a newborn's health. The temperature should be maintained between 35 degrees centigrade to 37 degrees centigrade. Child should be kept warm always. Any serious illness can cause hypothermia or lowering of the newborn's body temperature, which should be considered as a serious symptom to seek urgent medical attention. Bloated abdomen, or otherwise called as abdominal distension, is an important and a serious problem which should be considered as a grave marker in a newborn's health. Jaundice is very frequently seen in newborns. The jaundice can be of two types. The jaundice which is seen on the first day is not good. That is a pathological jaundice which might indicate a serious underlying blood or a liver issue. The jaundice which is normally seen between 3rd to 7th day and disappears by itself is considered as a normal jaundice. Sometimes the jaundice exceeds a certain value where the child should require medical attention, admission to the hospital, and administration of certain IV fluids, and also a placement of the child under a specific blue light which is called as a phototherapy. There are certain criteria for direct admission to the NICU, the neonatal intensive care unit, like the child which is born with extremely low birth weight or very low birth weight, like less than 1.5 kilos or 1 kilo, which requires more intensive monitoring. Presence of convulsions, bad medical history like abortions, etc., respiratory distress syndrome, meconium aspiration, not feeding well, and also hypothermia. Any newborns with the above symptoms may require an urgent medical attention.